All right, welcome and thank y'all for being here. This is the Board of Health meeting for November. And I was wondering if we might go around and ask everyone that's up here to introduce themselves. Maybe Lauren, we'll start with you and then we'll just come around. No. Thank you, Kelly.
Kelly Packsmith, member at large.
Ann Floyd Huggins, County Commissioner.
Scott McIntosh, optometrist.
Karina Kakarika, veterinarian.
Tina Dixon, vice chair.
Wes Gray, Health Director.
Herb Garrison, Chair.
Rick Splemon, member at large.
Lowell Spade, engineer.
Robert Penner, dentist.
Brian Wardell, County Attorney.
Thank you all and welcome everyone. And we got a pretty packed agenda, so we'll go ahead and get started. And the first thing we're going to do is approve the agenda. So I think all the members of the board have a copy of it, so if you'll take a quick look at it. And then a motion would be in order to approve the agenda as written here.
So moved.
I second.
Thank you all. It's been moved and seconded to approve the agenda. Any discussion? All those in favor say aye.
Aye.
Any opposed? All right, let's roll. Item number 4 is just to let you know that I've been reappointed by the county commissioners as the chair. And I appreciate them doing that. I did want to give you a heads up that I'm going to retire at some point, sometime in 2024 or 25, and we may need another
It's just been
chair.
more time to do this.
Pardon?
Just give you more time to do that.
Oh, thank you, Commissioner. I will tell you, though, that I can't think of a better board to be a part of. I've been on lots of groups, and over the past year, I can't imagine a better group to have been a part of, to go through all the things that we went through. It's just a very special group of people, and thank you all for being who you are. So let's press on, and we'll start with the school health update, and it says Lori Reed from ECU Health. Lori, thanks for being here tonight.
Thank you for having me. I appreciate some time to give you a little bit of information about our school health program here in Pitt County. We have received some temporary funding for some additional school nurses over the last couple of years. So I just wanted to tell you a little bit about our program and how that has assisted and how we've been able to help out through the pandemic. I'm going to try with this technology, but I'm not great. Okay, so this is just a little bit about our program. First of all, I'm Lori Reed, and I'm the nurse manager for the school health program. I've actually been with the school health program since 2006 as a school nurse and transitioned into the role as the nurse manager in 2021. So I was actually in the schools as a school nurse through the start of the pandemic, and then have also been on the other side of that as the nurse manager through the rest of the pandemic. So I'm able to see a little bit from both sides of that. But we currently have 25 school nurses that serve in 40 schools and programs. We serve pre-K through early colleges and also our alternative programs, Pitt Academy, Alpha, and the Project Search program. We do serve over 23,000 students at this time, and this data that I'm sharing is actually from the 2022 and 2023 school year. But we actually had about 4,500 students, or 20% of the students, reported one or more chronic health conditions in our school system. Our state average is about state average of students with one or more chronic conditions is about 15%, so we're a little bit higher in Eastern North Carolina. Our current nurse-to-student ratio is one nurse to about every 950 students. Of course, that varies some. We do have some high schools that are much larger than that do have one school nurse. And we currently have 13 schools with a dedicated school nurse, so they only have a nurse at their building. Before we have added the temporarily funded positions, we had a ratio of about 1 to 1,200 students, and we only had three schools that had a dedicated nurse, our 3 largest high schools here in Pitt County. Whereas the North Carolina average ratio in 2021 and 2022 is about 1 nurse for every 833 students. So what are and what were our roles through the pandemic in the schools? Really, the roles of the nurses that were hired through the pandemic were really no different than the current nurses that we had in our schools. What we did was we actually assigned them a very specific school assignment, and they served in the same role as the other school nurses. But because we had better ratios, we were able to serve those schools better. We didn't really have different roles, but as you can kind of see here in the list, our roles certainly changed and our priorities shifted through the pandemic. So During the active pandemic, of course, 99% of what we were doing in the schools was COVID mitigation. It was understanding the guidance, it was providing education, it was acute illness management in the schools, providing counseling to families, staff, and students on when they needed to quarantine, how long they needed to quarantine. We worked very closely with our public health department and making sure that we were doing our contact tracing, that we were excluding students and staff that needed to be excluded. We did do COVID testing in our schools. In the school year of 2021 and 2022, we did over 20,000 one-to-one COVID-19 counseling sessions. So that was really how we spent a vast majority of our time, was just pure COVID mitigation. Of course, the other responsibilities didn't go away. We were still having to coordinate care between the home, the school, and the medical setting to make sure that the students and staff were getting appropriate follow-up with their medical providers, that they were following the advice of their medical providers. Identifying our students with special health care needs, making sure that we had health care plans in place for them, educating our staff and how to make sure that they were safe and cared for at school, and delegating and routinely supervising medical procedures and medication administration at school. We have over 200 students in Pitt County that are medically fragile, that have special procedures that they require in schools. So we do have to train staff to be able to assist those students and oversee those procedures that are done at school. And all of that falls under our case management duties, which we were only able to do on a very limited basis through the pandemic. So thankfully, we've kind of moved into this endemic stage, and really everything has just kind of switched. Our list has, we've gone back to being able to provide a lot of case management services to make sure that those kids and those students that have those chronic and complex medical conditions have their needs met, to coordinate their care between their homes and their medical providers. We do a lot of counseling and education. And we do always do acute illness management. That's really kind of the expectation of a school nurse, but that is really not our main priority on a day-to-day basis normally. We are there to do that, but not every nurse is in every building every day, so we can't do that 100% of the time. So the school health funding streams that we have right now for our permanent positions are as listed up here. ECU Health Medical Center does provide funding for 9 of the positions, and one of those is my nurse manager position, and then 8 school nurses. We do have 5 positions that are funded through the North Carolina Department of Health and Human Services. This is School Nurse Funding Initiative money, and then Pitt County Schools is covering 8 full-time positions. Now, I will go back and just say a little bit about the School Nurse Funding Initiative. Those 5 positions are contingent upon Pitt County remaining or continuing to maintain permanently 15 positions that serve K through 12 students in Pitt County. So if we don't maintain a minimum of 15 positions, then we lose those 5 positions. So this was the funding stream for our temporary positions. This is a lot of terminology, but as you can see, we've just had a lot of transition over the last 2 years in the funding of the temporary positions that we have. They're currently being funded through the ARPA funding. And when that is expended in May of 2024, then it'll go back over to the ESSER funding, which was provided to the school system. That's the ELC funding started out because we were providing COVID testing in the schools. We were provided with this laboratory capacity funding. So that's kind of the transition of what we've seen with our temporary positions. So currently, our funding for these positions actually does run out in June of 2024. So just some of our outcomes on here. I'm not going to read all these to you, but I would like to highlight that our main outcome that I think is really important is that 92% of our students who are actually seen and assessed by our school nurses remain at school. So that's a good significant amount of students. You know, when the nurse is not there to be able to determine whether or not those kids should remain at school, a lot of them are just sent home. So it's really important that we're able to keep those kids in school. As I mentioned before, we had over 5,000 individual health care plans for students, and we oversaw 2,200 student medications being administered in our schools. And EMS calls were 2 times more likely when the school nurse was not on site. So we are able to prevent some emergency phone calls. We provided over 10,000 health counseling sessions. We had 802 students enrolled in ongoing case management, which is up from 537 that we had in the 21-22 school year. So having more nurses, we were able to really provide that complex case management. Of course, we do health promotion through screenings and health education. These are just a couple of the stories that I thought were really important. But when we do have school nurses at school, things don't get missed. We've had students that have come to the nurse and just thought, oh, I have a pimple on my arm. Well, it ended up being MRSA, and the student ended up having to have a surgical procedure on their arm. So if that had not been identified, there's no telling really what had happened to that student. We actually had a student that went into cardiac arrest in school. They were in PE. The nurse was called down to the gym for a student that had become unresponsive, and with the assistance of the school first responder and the nurse, they were able to successfully resuscitate that student, and he's gone on to be very healthy. So what are our challenges post-pandemic? We actually, we may not be doing as much COVID mitigation in the schools as we were. We're not doing COVID testing. We're not having to do contact tracing and isolate students and things like that. But we've had a lot of challenges following the post-pandemic. There was a lot of delayed and inconsistent medical care during the pandemic and lack of follow-up. We've had so many students enrolling in school without their health assessments, without their immunizations. It's been a real challenge that we've had to try to address with our health department and our physicians' offices. We've had many students, because they have not had their physicals going into school, that have not had physical or intellectual development concerns identified, so there's not been any early intervention services, there's not been any individual education program plans put in place. So these students are showing up in school in kindergarten, and we just can't appropriately educate them and take care of them because a lot of these screenings did not take place ahead of that. So that's just really become a priority of the nurses. And of course, inconsistent management of their chronic conditions has really necessitated that the nurses be much more involved with the care of these kids in school. We've seen an increase in mental and behavioral health issues. There's been a 20% increase in referrals related to substance abuse, that being drugs and tobacco and e-cigarettes, anxiety and depression from school year 2021. So that's 20% higher of those referrals. And then more students are needing exceptional children evaluations. That kind of goes back to my first point. The very first step in evaluating a student for special education services is they have to have a health screening by the school nurse. And we've already had, this school year, we're 3 months in, we've had 427 of those health screening requests, whereas last year we had 880 total. So we're on track to having almost twice as many this school year. Of course, we still have ongoing attendance concerns, and we have had increased homelessness. And our school teams, our nurses, counselors, social workers have really had to work intensely and closely together to address the needs of these students and families. And that's really all I had to share with you tonight, unless you have any questions for me.
Lori, thank you. That was a great report. Any questions for Lori? Thank y'all so much. That's just an incredible service y'all are
Thank you.
doing, and especially keeping the kids in school, saving their lives. And it's incredible. Thank you. All right. Next, communicable disease annual report. Lee, you're up.
I can find this. Allison, maybe you can help me find it. Well, Allison helps me find this. Well, if not, I have it on my paper. I'm Lee Cutler. I'm the Director of Nursing at the Pitt County Health Department. And hopefully to the pleasure of those of you that have sat here and listened to me, I think for the past 5 or 6 years, give a communicable disease update. We're going to change it up tonight, so it'll be a little something different. So hopefully that will be to y'all's pleasure. So I just wanted to, looking at what we're supposed to be talking about with y'all is atypical events that are happening. So I just wanted to share a few items of things that have happened this year in 2023. We're almost at the end of 2023, so I didn't think we needed to go rehash what happened in 2022. So just as a reminder, the local health department is charged overall, at the end of the day, with being the ones that are responsible for investigating communicable disease reports and doing any type of control measures, issuing isolation, quarantine authorities, that type of thing. So most recently, the most interesting situation that we've had was there was an active case of TB at one of our local schools. And so just to kind of give you the run through of how we worked with this, on October 10th, I was notified that day of a positive TB case. reviewing the medical chart, saw that the person was affiliated with a local school. I ended up being the person to call that individual to let them know that their test had come back positive for TB because they weren't aware of that. So I called the person that left a message. They called me back, and I was like, this is what happened. You've tested positive for tuberculosis. You're infectious. You need to put a mask on now and return home immediately after you talk with, I guess, your people at school. That afternoon, did a home visit with the individual for our basic interview to talk about direct observed therapy, medication, contacts, that type of thing. So on the 11th, and I believe on the 10th, Lori, I can't remember if it was the 10th or 11th that we notified y'all, pretty much same day, word was getting around. So on the 11th, the day after, because I didn't interview the person until later that afternoon on the 10th, we began the family and friends contact investigation, notifying those individuals, getting them in for testing. And also Pitt County Schools and the Health Department, we began doing, y'all started doing the contact investigation for the local school system, who was being identified as somebody that needed to be tested. Again, so the school system, Lori Reed and her nurses and staff worked together quickly on that, generating a list of individuals that we'd need to notify, them coming up with the plan of how it was going to be, how they would be notified. So on the 13th, the general notification was made by Pitt County Schools, kind of an all call to everybody, just letting them know that something had happened. And then on the 16th, another notification was made specific to those individuals that were identified as a contact that needed to be tested. On the 20th, we had worked with Lori and her nurses. Most of the nurses that were there helping us were the school nurses, so we didn't have to pull a lot of people out of the health department to come do the testing. On the 20th, we went to the school and we either performed skin tests, the PPD skin test, or did quantiferon blood draws on the individuals. So we did that. We ended up finishing up the PPD testing completely, I think, on the 25th. We had to go back and read them. Then those that weren't there, which we got most of them that same day, which was surprising. But there were a few people that were absent, and a few people had already tested somewhere else after they'd, heard about the situation at their pediatrician's office or something. And then and so far, there hasn't been anybody that's had a positive test coming out of the school system from a possible exposure. So we'll return on December, I think we've come up with December 11th and 13th to do our second round of testing, because we'll have to test everyone, since that'll be past the 8-week mark after the last exposure, possibly, to the person. So we identified 145 contacts through the school system. 141 were tested. Like I said, a few of them, 4 had tested elsewhere. And so hopefully the second go-round will go as smoothly as the first go-round, working with that situation. Our second item of interest, I guess, would be syphilis. I don't know if y'all have seen in the news recently. I keep seeing more and more things, articles. I know the Department of Health and Human Services just put something out. I think they put out a provider memo to all the providers, reminding individuals what the testing guidelines are for prenatal patients for syphilis testing. I know the past few years I've been talking about the syphilis rates have been going up. And as you can see from this slide, 2020 we had 57 early syphilis cases, meaning they were symptomatic, they were infectious to other individuals. In 2022 we had 87 cases. And then for 2023, these numbers are just from January to June. So if we're going that way, then we're going to probably max out last year's number. And then the red bar is looking at our congenital syphilis cases. So 2021, we had 2. Last year, there was 1. And thus far this year, there have been 4. So, and that's just for Pitt County. And I know the most recent article, I think, that DHHS put out was, I think they were talking about, I think in North Carolina, there's been either 3 or 5 stillborn deaths because of congenital syphilis, which is obviously the worst outcome that can happen. But it's very easily identified if people do the correct testing, and it's very easily treatable if they're identified to be able to get them treated. These probable cases, every single one of those are a probable because the mother didn't get treated within 30 days of delivery. So as long as they're identified, they get treatment within 30 days of their delivery, then as long as testing comes back fine on the baby, then they're not going to be considered a case. But even if all the testing is fine, if the mom still did not get adequate treatment within 30 days of delivery, they're going to be considered a probable case per CDC's guidelines. Our other adventure that we did with the school immunizations, again, partnering with the school health nurses. Every year in the fall, individuals that are, once, I think it's the 30-day mark where they might get asked to leave school because they haven't been updated with their immunizations. And again, I still think a lot of kids are trying to catch up from not being able to have been seen the last few years, COVID, whatever was going on. So we came up with 7 days at the health department. We had 580 appointments available. 497 were scheduled, and then actually 430 patients came in and were seen. And a lot of Lori's nurses came to help us on those days again, so that all of our staff weren't being pulled. We were still able to maintain our other clinic appointments. And then our STI Express clinic, which we've talked about this with y'all, we began at the very end of July. It's still going really well. These are our numbers so far that we've had August, September, and October. You can see the numbers. Patients scheduled, patients seen, and then our new infections. And then these are the lab results that have come out from August, September, and October. So we're definitely identifying infections in the clinic. And our demographic data between race, insured, uninsured, and then male and female. Any questions about any of those items? Are there BTV, syphilis, or immunizations, or the STD clinic?
Any questions for Lee? Sort of shows how critical the interface between y'all and the school nurses are, because
Oh, yeah.
they were a big part of a lot of your report.
Yeah, they definitely are. So, I mean,
Yeah.
anytime something happens, I mean, I feel like even if it's something that's not with the schools, if I needed help with something, we could probably ask them and Laura to do what she could to make it happen, to help us out. So we definitely appreciate that.
Great report, Lee, thank you. Do we need to vote to receive that report? No, okay, good, thanks. All right, I want to welcome Wes Grave officially as our health director. So he was on the call last time, but not in any official capacity. But he then, I think, over the next few days after that, it hit the ground running, and he's been going since then. So Wes, we're so glad you're here and welcome, and this will be your first official act for the board.
Great. Thank you, Mr. Chairman. Glad to be here, of course. I'm going to present tonight the items for decision, and then I'm also going to do the finance report, and then after that, my health director's report. So I'll start with items for decision. First of the items is addition of the RSV vaccine, Brisvio, to the fee schedule for 2023-2024. Our medical director for maternal health is recommending we add this RSV vaccination for prenatal patients between 32 and 36 weeks gestation. We'd like to offer this Pfizer RSV vaccine, currently covered by most of our insurance plans that we accept that are covered for our prenatal care patients. We're proposing the fee of $329. We take into account the cost of the drug at a rate of $275 per dose. Insurance reimbursements vary at $300 to $310, and then our administration fee of $19. And we've also had meetings yesterday with Pfizer about a program to be qualified for the program to provide this to uninsured patients as well. But this is strictly for the self-pay and insurance patients. And this requires a vote of the board.
Any questions? All right, so a motion would be ordered to approve the RSV fee schedule.
I moved.
Been moved and seconded. You got those, Lauren? Any discussion? All right, all those in favor say aye. Aye. Any opposed? All right, next would be the Fords.
Yes, this is the approval of purchase of 2 Ford Expeditions for communicable disease staff. This was be expenditure from Agreement Addendum 543, COVID funding. We've received prior approval necessary from DHHS to purchase 2 SUVs for the use of communicable disease nursing staff. Vehicles will be outfitted with pull-out drawer systems in the back for gear and set up as mobile clinic spaces or to haul clinical gear to a non-clinic location. Fleet Manager Maynard has secured the contract pricing quote from the NC Sheriff's Association. The vehicles can be delivered by the end of May 2024. Each vehicle is quoted at $55,015 for a total of $110,030. Again, no county dollars will be used for the purchase of these vehicles.
So back in 2001, I became one of the surveillance bioterrorism doctors for Pitt County in eastern North Carolina, working for John Morrow, and we had a Durango that was purchased with federal money, and we outfitted it with lights and sirens. And we were the only vehicle like that in the state, and when we showed up at the big state health meeting, they loved it. And but that was because of my emergency background. But I hope, Lee, you'll be looking out for something like that for your trucks.
Is still there? She's still there.
Oh, really? Oh,
She's still there.
oh my goodness. We didn't use any county money, Mike, on that.
I had a new employee get in, a young employee, that had the regular car key to start it, and they didn't know how to start the car.
Because there wasn't a button to push. Oh, my goodness.
How do you start this?
Well, we responded to a lot of hurricanes with that vehicle. It was great. All right, enough stories. Any questions about the Ford Expeditions? So a motion would be in order to approve the purchase of the 2 Ford Expeditions with non-county funds.
Second.
It's been moved and seconded. Any discussion? All those in favor say aye. Any opposed? Wes?
Thank you. All right, the approval of a contract for the bid of the addition of a negative pressure room at the Health Department. Building and Grounds Director Brian has worked with getting estimates for the addition of negative pressure room. He has received a rough quote estimate of $147,000. We've received engineering plans and are now ready to move towards the bidding process. Seeking board approval to request a put out for bid of the negative pressure room not to exceed the pre-approved amount of $147,000. And this project is being funded by agreement at end of 546 communicable disease pandemic recovery dollars, and no county dollars will be spent on the project.
Lowell? Does it sound okay to you?
Sound good to me.
Okay, good. Any questions for Wes on the negative pressure room? So a motion would be in order to approve the bid for addition of a negative pressure room.
So moved.
So it's been moved and seconded. That was Tina and Commissioner Huggins there, Lauren. And any discussion? All those in favor say aye. Any opposed? Wes?
And the last one is the approval of a contract for an advanced practitioner 2. In an effort to aid staffing for our clinic, we're proposing trying to recruit a contract advanced nurse practitioner 1 through the North Carolina Alliance for Public Health Agencies. We estimate that this contract would not exceed $48,000 through the end of June 30th. Mainly the purpose of this is we're currently been recruiting for an advanced practitioner 2, and it's been very difficult to recruit for that. We do have hopefully some potential candidates that would qualify for this contract that might not for our some of the requirements for the 2.
Any questions for Wes?
I do have a quick question.
Yes,
So
ma'am.
what's the difference between a 1 and a 2 as far as eligibility?
Well, the 2, you have to have at least a year of experience as a advanced practice provider, like right out of school, and then be at work against for a year. We can't qualify somebody for that 2 unless they at least have a whole year of experience. So we can get some applicants that have had less than that year. So this will allow us to get to that, and then hopefully the idea would be them to apply as a 2 next fiscal year, or when they hit that year mark.
Any other questions for Wes? So a motion would be in order to approve the contract for the advanced practitioner 1.
So moved.
Second.
Moved and seconded. Thank y'all. Any discussion? All those in favor say aye. Any opposed? So that stands approved. Thank you, Wes. And so monthly financial report.
Yes. Angie Mann is away at a training tonight, so I'm going to go through the financial report for everybody. The first in your packet is the July 1 through October 31st financial report. As you can see, our current total revenue for those months are $4.9 million. Total expenses, $3.9 million. With $990,000 in the black for those first months, to July through the end of October. Some of the programs in red that are negative are the programs that we get reimbursed with the next month from our Ada County system. So overall, I think we're looking very good, and I'll be happy to answer any questions you have about any of the programs.
Any questions for Wes on the finances? All right, so I think we need to approve the monthly financial report, so a motion would be in order to do that.
So moved.
Second.
Moved and seconded to approve the monthly financial report. Any discussion? All those in favor say aye.
Aye.
Any opposed? Thank you, Wes.
All right, the first quarter report for 2023-2024 fiscal year. Revenues for that first quarter were $3,714,036, around 25% of, so that's right on track of where we're supposed to be for receiving revenues. Our expenses were $2,878,002, and that's at 19.4%. And so that closely mirrors what we saw last year. So we're doing really well, and spending less than we anticipated.
I don't think we have to approve that, do we?
The grant report, 3 grants, ECU Health Foundation Diabetes Recognition Program. We received the $50,000, 100% of that funding. We put for the Martin Pitt Partnership, Nurse Family Partnership funding, we pulled down 28% of that funding, a little over $10,000. And then the Martin Pitt Partnership Smart Start Program, we pulled down $36,712, or around 27% of that grant for the year.
Any questions for Wes on the grant income report? Press on.
All right, and then the last slide is the budget amendments. There's 15 amendments in here. A recognition of funding through October 31st. And I'll go through some of these later on, but one of the major ones is, you'll see our Medicaid cost settlement came in. So it's $711,746. And it's unusual. Usually it comes in one check a year. But it looks like this time they're breaking it down in 3, so I anticipate 2 more smaller checks. This is the bulk of it, but we'll likely see that probably in the next month coming in. Also, $1,500 we received a donation from Greenville Civic Ballet, and then happy to answer any more of these, but mostly these are AAs that have increased some of the funding for their programs.
Any questions for Wes on that? Okay, great.
That ends the financial report. I will roll on to the health director's report. And a little bit of an overview. I'll do a COVID-19 update, just some a continuation of what Teresa presented last month, and then respiratory virus surveillance, HR updates, media updates, and then some public health highlights for the department that everybody should know about. Looking really good on the COVID front. We received these from Bill Cleve and the EPI team at ECU Health. We were at 30 inpatients across their system. 5 of those patients are in the ICU and 4 on the ventilator that tested positive for COVID. So those numbers continue to go down. About 2 weeks ago we saw a flattening of it, but then it's started to go back down again. Wastewater monitoring. This has definitely been positive because since the middle of September 15th, we saw a decrease in wastewater testing for COVID. And then you see a kind of a flattening in the beginning of October, so we were kind of wanted to monitor that a little bit more, like, hey, is it stopped here? Is it going to go back up? It looks like it paused for about 3 weeks, and then it's continued to drop. Emergency department visits for COVID, for respiratory viruses. So this looks at total respiratory, those purple bars, COVID-like illnesses, those the blue line, influenza-like is the green line, and RSV is the yellow. So we did see that total COVID-like start to go up in September, as we did see on the wastewater, and then we saw on the ECU slides, we saw that little peak after September that's going back down. We are closely monitoring the RSV and the influenza-like because that's anticipated to rise. And then last year, typically your flu peaks in the end of January and then starts going back down. And during the 2 COVID years, 2020 and 21, we had very, very low flu seasons, and because everybody was masking and distancing. And then last year we had that atypical year when we peaked for flu and RSV in November, towards the end of Thanksgiving. Then it started going, then it continuously went down and never went back up in January. So we want to see what it's going to do this year. And so as you can see, last year, that blue line, that influenza and the RSV all were happening, started to ramp up in November. Thanksgiving, they started to plummet, never picked back up. So right now, we're looking at your influenza A and B, that red and blue line, are still very low, but the RSV is starting to go up. So we want to continue to closely monitor that. And then this confirms it. You know, we're seeing, this is the weekly respiratory virus surveillance from ECU, and we're looking at these lines around September 23rd. You see kind of a little peak there, and that was the rhinovirus, intravirus, that kind of beige color. That was the biggest percentage of the viral load in these samples. And then that started to go down. That kind of coincides with school starting and all that, different things. But that started to go down, and you're starting to see the red line, which is RSV, take up a bigger proportion of these tests every week. And that's going to continue to probably grow. We don't see too much increase in flu A or B, decrease in the rhinovirus and all, but the RSV, that red, is really the thing that's jumping up, in my attention, out of these numbers. And we'll likely see that continue to grow the next several weeks. So, and then the percentage of influenza-like illnesses at emergency department visits, the red line is the current year, so it's a lot less than last year. That is positive. So last year we saw that really sharp peak starting to go up in November, and that continuing up. We're not seeing that same level of increase as we did last year, so it's not as sharp of an increase. And then does anybody have any questions about any of the respiratory updates or COVID illness? All right, HR updates. So we've got new positions. Well, I'm new employees. I'm new, so I'm one of them. And then we got Kimberly Moses is helping us out in the HR office. Resignations, we did have Robin Tant. So and these are our posted positions. We have a medical lab assistant 3, a medical office assistant, a nutrition program director 2, 6 public health nursing positions in various capacities, public health nurse 3 position, and a social worker 2. And I'm about to open up the dental position again because I think we have some promising applicants. So that is our HR update. Media update, just a kind of idea of what we've been promoting the last month since your last meeting, our no-cost COVID tests. Of course, we did a lot of media around the TB case, the food recall, safety alert for the Wanda Banana Apple Cinnamon Fruit Puree, and then we did press releases for our Taste of Wellness event, which is tomorrow at the Ag Center for diabetes, and then also to promote no-cost immunizations for flu and for COVID tests, COVID shots. Some of the public health highlights, Tiffany Thigpen, our Region 10 Tobacco Prevention and Control Coordinator. She's the SOFI President, which is the North Carolina Society of Public Health Educators. So we're real proud of her. And they had their annual meeting earlier this month in Fayetteville, and she led that conference. So great job, Tiffany. And then Tashonda Hill, our Environmental Health Specialist. She's the North Carolina Environmental Health Supervisors Association has been nominated as President-elect, so she'll take office next year. So that's great that she'll represent us on that board. And will also serve as the Environmental Health Representative to the North Carolina Health Directors Association meetings. And then Dr. Garrison has been appointed to the Association of North Carolina Boards of Health. So congratulations as their physician member. So that's a great honor. And then tomorrow, as I mentioned, the Taste of Wellness event is from 10 to 12 over at the Extension office. And we'll have life coaches, mindful movement, cooking demonstrations, community resources, games and prizes, all to promote wellness and especially, making sure we're catching folks that are, say, pre-diabetic or leaning towards a diabetic diagnosis. And then we also got our dental van. That's our dental trailer is here. It's behind the old one for right now where we're switching out some of the equipment and all. But we're real excited to have that back, or have the new unit there and been wrapped with our new branding. And then, of course, we did a drive-through flu clinics for county employees, and over 2 days we had a great turnout. And thanks for everybody that helped with that, and emergency management services that helped us out, and the parking lot over at Extension that helped us. Had a great turnout of employees that came out there. If employees still need shots, they can come to the health department or anybody in the public that like to have one. It's not too late to get your shot for this year. And then, lastly, I'll mention. October is Breast Cancer Awareness Month, and Greenville Civic Ballet did a great thing this year, and they put the proceeds from their Aladdin performance to a project, and they wanted to donate to a breast cancer cause, so they donate to the health department to help out our breast cancer cervical cancer prevention program. So a BSEP donation of $1,500. So that was a great thing that they did for us, and really appreciate that from Greenville Civic Ballet. right, and that is the end of the presentation. Be happy to answer any questions y'all might have. As you can see, our staff loved Halloween, so we all got into it that day.
Any questions for Director Gray? How's it going? Do you like it here? Are you happy?
Yeah, love it. It's going great. Staff's awesome. Everything's good, so,
It is an awesome staff.
yes.
And we're happy to have you here.
Yes.
Glad to be here. Thank you.
All right. Thank you, Wes. Much appreciated. So our last item on the agenda is approval of the minutes. And y'all received those in your email from Lauren. Lauren, thanks for doing that. I did notice one correction, and that was our county attorney's first name is B-R-Y-A-N. He said in New York, where he lived, there were a lot of Brian's, B-R-I-A-N, but he actually changed it back to B-R-Y-A-N when he came down.
You blame that on my mom.
All right, any other corrections or improvements for the minutes? Lauren, thank you very much for doing that. And if not, a motion would be in order to accept the minutes and approve those minutes as corrected, or any other corrections.
So moved.
And second?
Second.
So it's been moved and seconded to approve the minutes. And any discussion? All those in favor say aye. Any opposed? I feel like we should hang around for just a little bit, do a little bit more work, but we don't have to. Oh, that's right. Oh, so we need to be done. Okay. So please hang around for your photo. Anything else for the good of the order? If not, we'll entertain a motion to adjourn.
So moved.
Second.
It's been moved and seconded. If there's no objection, we'll stand adjourned. Thank you all very much.